When? What about Jason? What about the baby? Was he with her? Thank God.
Alan,
How is she?
what happened?
Susan's been in an accident, a bad one. She's in surgery now. They don't think she's gonna make it.
How's she doing?
Not good. She has arrhythmias.
Well, hang in there.
There's a short run of VTAC.
Well, I can't go any faster.
Lidocaine, 75 milligrams, IV push, followed by lidocaine drip at 4 milligrams per minute. Fast. Heart stabilized, normal sinus rhythm.
All right, good work, Rick. Keep an eye on her. Shouldn't take me too much longer to treat this fracture.
Mark, the heart is stabilized, but it is still very, very weak.
I understand that.
I don't think it's strong enough for you to continue.
What do you suggest we do?
Suggest you close now.
I can't do that.
I don't think you have any other choice.
And risk the chance of leaving her paralyzed forever.
If her heart stops, that doesn't make much difference, does it?
What if it doesn't?
I don't think that's a chance that I would take.
Then the alternative is one I can't accept. Now, we have to complete this surgery immediately.
Mark, close now. You can go back for that later.
I can't do that. I have to finish what I started.
You may finish your patient.
Now, listen to me, doctor. This woman has suffered a critical fracture.
She has also suffered blunt trauma to the chest with cardiac contusion.
I have taken that into consideration.
You asked for my opinion. I'm giving it to you. You are risking her life.
You're the cardiologist. I'm the chief surgeon. I understand what you're saying. I'm overruling you.
You are risking her life.
I'm trying to save it, damn it! And we don't waste time arguing. I may have a chance to succeed. I've made my decision. Come here, Sponge.
Mark, make it understood that I'm assuming no responsibility for what's about to take place here. You are placing her life in grave danger.
Are you through?
For now, yes.
Let's get on with it. Well, she made it.
I hope it was worth it.
She's still alive.
For a few hours, a few days, her recovery, uncertain at best, is now even more risk because of your decision.
I did what I felt was best for the patient, Rick.
I hope it is best for the patient for her sake. But I don't think it is, Doctor.
I'm not going to lie to you. Susan suffered massive internal injuries. Her condition is critical at best.
What you gonna do?
I don't know. It doesn't look very good. Now, that doesn't mean she won't pull through. I've seen it happen before, but all we can do now is wait.
Can I see her?
Well, she's in recovery, but I'll let you see her for a moment. What she needs more than your presence is your prayers.
I understand.
Okay, I'll let you know when you can see her.
Please, please.
Now, if you need me for anything, if you want me to talk to you, whatever, call me.
Thank you.
Sit down, gentlemen.
See?
Got a problem, Steve?
I was hoping you could tell me. I sent for you because I wanted a report on Susan Moore.
Well, what in particular?
How it went in surgery?
It was about as expected. She survived, but she's still in very critical condition.
I know all that.
Then what?
Tell me what happened during the surgery.
Rumors travel fast here, don't they, Steve?
You denying it? Well?
I have nothing to say.
Two senior doctors decide to do battle over a patient right in the middle of an operation, and neither of you cares to discuss it? Well, permit me to insist. I want to know what it was all about. Mark, you're the chief surgeon?
The patient suffered an unstable cervical fracture with blunt trauma to the chest with possible cardiac contusion. Due to the severity of the fracture, I decided to operate immediately. I asked Dr. Weber to be present because of the cardiac problem.
Rick?
In the second hour of the operation, arrhythmias developed. We administered lidocaine. Heartbeat went back to a normal sinus rhythm. However, I recommended very strongly against continuing the surgery because of the weak heart.
And you disagreed?
Dr. Dante overruled my decision, placing the woman's life in great jeopardy.
Steve,
We had just gotten that heart stabilized.
I felt I couldn't stop at that point. The nature of the fracture was such
You
that...
could have gone back in for that at some other time. There was no sense in jeopardizing her life to such an extent.
Of course, if you consider paralysis as an alternative.
All right, stop it. I asked for an explanation, not a reenactment. Now, you're both professionals. At least you were until you gave good sense away to bicker over a procedure during an operation.
He completely ignored my recommendation at great risk to the patient's
I
life.
rejected it, but I did consider it.
Well, why did you call me in if you weren't going to take my recommendation?
Because I thought I was...
May I interrupt? May I interrupt for a moment? Now, each of you did what you felt was right. The patient survived, and we hope she'll live and won't be paralyzed. That much, at least, we all agree on, but the rest is unimportant. And if you insist on fighting it out, you'll have to do it somewhere else, on your own time. As far as this hospital is concerned, the matter is closed. Is that understood?
Rick? Rick, any news of that, Susan?
I'm just on my way to find out.
Dr. Dante, Dr. Weber, it's Miss Moore. She's fibrillating.
Recovery staffed.
They've got to save her. The Jasons say they've got to save her. Oh.